From the News Channel 5 Network, this is OpenLine.
Hello everyone, welcome to OpenLine. We are here tonight to help you navigate the Affordable Care Act. Now there are 2 weeks left in the open enrollment period, just 2 weeks left. So there are probably a lot of you that have questions about, are you eligible? How do you sign up? What do you do? So we want to help you tonight in this final 2-week open enrollment period. Happy to have with us two people who can answer your questions. Mary Hunt, lead navigator with Family and Children's, or no, you're with Get Covered Tennessee. Thank you for being here.
I am a navigator with
and you're
Family and
also a
Children's
navigator.
Service, yes.
Okay, good. And Sharon Barker, lead navigator with Family and Children's Service. Thank you, Sharon.
You're very welcome.
Thank you for being here. All right, so what are y'all seeing? You're getting lots of calls at this point. We're in the final 2 weeks. What are some of the things you're hearing from callers and you're seeing at this point? And who wants to take that?
Well, I'll go ahead and take that. Basically, right now, people are just really trying to make certain they get in under that 31st deadline, most notably that January 15th deadline in order for their insurance to be effective on February the 1st. So I'm just getting a lot of calls to make certain that they can get in under that and make sure that they have their insurance in place and don't get hit with that tax penalty for not getting insured.
So who are you hearing from? Are you hearing from people who, generally speaking, who signed up before and kind of know what to expect when they call? Or are you hearing from people that really don't know how long it's going to take and you're taking them from the very start of this enrollment?
I'm getting a mix of both. I'm getting a lot of repeaters, people that I helped enroll during OE1, which is Open Enrollment 1, and I've become good friends with so many people because they come back to me year after year to re-enroll. But I am also getting a good mix of new enrollees, which is very, very encouraging to see.
And what is some of the news? What do people need to know in this final 2 weeks? There are some penalties and that kind of thing. What are some things people need to know?
Well, January 31st is the deadline for this enrollment period. So if you miss that deadline, there won't be another chance to enroll for 2016 coverage. Very important not to miss that. A lot of folks will start filing their taxes here pretty soon. If they didn't have insurance last year in 2015, they'll be paying a penalty when they file their taxes. For this year, it's around $300. Next year, it's going to more than double, and the minimum penalty per person will be $695.
Really? The minimum penalty will be $700?
Yep.
Wow.
It's $695 or 2.5% of their income, whichever is higher.
Okay. Wow. So the penalty really kicks in.
It really kicks in.
So that means people need to enroll in this final 2 weeks.
If they miss this deadline, unfortunately, that's their last call for 2016.
And then you hear, people have questions. They've heard all kinds of things. So if they call, I guess walk us through what happens. Let's say they haven't ever done this before. They see this show, they want to get in, before the deadline, but they have no idea what kind of coverage they want or what's going to happen. Kind of walk through how long it takes and just what happens.
Yeah, excuse me. It's a very simple process. When somebody calls in and they get an appointment with a navigator, an in-person assister like myself, I will take their information and set up an appointment with them to meet them one-on-one, face-to-face, and sit down and go from the beginning. Set up an account online with them through healthcare.gov. If they need me to set up an email address so that we can complete an application, I can do that. And then we go through the application step by step, a very simple application. And once they complete the application, they know immediately if they're eligible for private insurance through the marketplace. That could be a Blue Cross Blue Shield policy, that could be a Humana, a United Healthcare, a Cigna policy. And they can also determine whether or not they're eligible for TennCare at the same time, or CHIP, or Medicaid, well, not Medicare, but the Cover Kids. And then after that, we go through and we look at plans. We are able to determine if they are eligible for a tax credit or help paying for their insurance, or help paying those out-of-pocket costs, which is your cost share reduction discounts. We go through and explain all of that to them. If somebody is, kind of health insurance illiterate, so to speak, we can explain to them deductibles and co-pays and co-insurance, all of those health terms that a new person may not understand. Once we get through that, then we can help them sit down and look at plans, and all the metal tiers, silver, bronze, platinum, gold, and we help them to determine what best fits their needs and what would be a good fit for them. We do not tell them what to pick, but we give them really good information to make a good informed decision for them and their family. Once we go through that, they can either enroll right there, or they can say, let me think about it a minute. I want to go home, run it by, look at my budget. And they can either enroll by themselves at home if they're comfortable with that, or they can call the 800 number, healthcare.gov, or they can call me back and say, hey, Sharon, I'm ready to enroll. Can you help me? And I can come back and do it. So sometimes it's a one-step process. Sometimes it may be a two-step process. I have a guy that has called me probably every day this week because he hasn't decided. So,
oh, really?
Yeah. So, and he's really being diligent about calling his doctors, and we can do that as well. We can sit there with you and say, let's put your doctor and your medications in to see if they're going to be covered under this plan. We really are meticulous about helping them to make an informed choice as to what's best for them and helping them to understand if they're eligible for help paying for their coverage.
So how many options are there, and what's the range of cost?
Well, the options for insurance companies, there are 4, which I mentioned, okay? And then you have the metal tiers. You have your bronze, your silver, your gold, and your platinum. And to determine what's your premium going to be, that's going to be based on your household size and your income, your household income, and then you can determine what your discount will be, whether or not you fall in 100% of the federal poverty level up to the 400%. That would be where you're going to look at where you're going to get help paying for your premium. And if you're 100 to 200% of the federal poverty limit, that'll help you understand the cost share reduction discounts that you're eligible for. So it's kind of hard to kind of give you a ballpark, but I can just maybe take, a person, maybe one person in a household, in a tax household, and they may like $12,000 a year, and they may be like 30,
Right.
Yeah, they can see a premium, anywhere from $7-8 a month on up to what, about $100,
it can really, because Sharon mentioned the platinum tier. We don't see a whole lot of people choosing that, but you can go all the way up and pay $600-700 a month for one person if you want to.
Right.
So it depends on the person.
It depends.
Silver is what most people choose.
Most people choose.
Okay.
It's been kind of traditionally the benchmark level plan.
So let's say you are this a 29-year-old person, you're healthy, and you're just worried about the penalty. You don't want to pay the $650 penalty at the end of next year, so you want the cheapest thing out there. What kind of works? Do you have people calling like that, and what do you tell them?
Yeah, there's a lot of people whose main objective is just to not get the penalty. They don't think they need health insurance. They might be healthy, young, like you mentioned. If they are under 30, there is another category that's available to them called catastrophic. It's similar to the bronze level coverage, maybe a little bit less coverage. The premium might be a little bit lower than bronze. Really in Tennessee it's about the same, but it's a special category that's open only to those under 30. And it's a lower premium with just a really high deductible. It's kind of a plan just there in case something catastrophic happens. But for most young people that we sit down with, they might start out saying, I just want the lowest plan.
Right.
But a lot of times because of the discounts that Sharon mentioned, particularly the cost sharing reduction, which is what helps folks get lower deductibles and copays, that is applied to the silver plans only. So sometimes the silver plan might be an even better deal for them than the bronze or the catastrophic, depending on their income. So
the other big question is how many people are actually signing up? What are you seeing right now in Tennessee? And I know we're part of a challenge. So let's talk about that. How many other cities are we competing against, and where do we stand there?
Well, Nashville is part of a 20-city challenge. It's a presidential challenge. It's Healthy Communities Challenge. And the goal is to reduce the uninsured rates in these 20 cities. So we're all in a friendly competition with each other. And whichever city reduces its uninsured rate the most will get a visit from the president. So, so far we're doing really well in the challenge. We're number 8 out of 20. which is very impressive, particularly considering that some of the cities in the challenge are in states that have expanded their Medicaid programs. So they have a few more options for folks. So considering that, we're doing extremely well. In Tennessee as a whole, we've had about 230,000 people sign up so far. So that's a really good number, and we still have the next 2 weeks to look forward to. The last 2 weeks of open enrollment are usually the busiest because human nature is to wait until the last minute. So we're expecting that by January 31st, the numbers are going to be really impressive.
We're number 8. Who are our big competitors? Who else is out there?
Atlanta is on the challenge. Personally, I think they're probably our biggest competitor just because regionally they're the closest to us, and they're doing very well on the challenge as well. Some of the other cities, there's Dallas is on there, Tampa, Seattle, Salt Lake City, Kansas City, Chicago's another big competitor.
That's very interesting. Okay,
yeah.
So we're right in there. Okay, all right. We're going to take a break, and I encourage you to call in if you have questions. This is an opportunity to get your questions answered. You can lay out your situation and get some guidance, some directive. There's the number, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.